Good morning and welcome to United Way for Southeastern Michigan's virtual town hall. My name is Audrey Walker and I will be your moderator for today's town hall. Today we will hear from United Way's President and CEO, Dr. Darian Hudson, and then United Way's own Jeff Miles and Delonda McCullum will provide information on our new Connect4Care Kids initiative. The last 10 minutes of today's town hall are reserved for questions. Please leave your questions in the Q&A box if you're watching on Zoom or in the comment box on Facebook. Now I would like to give a warm welcome to United Way's President and CEO, Dr. Darian Hudson, to say a few words.
Thank you, Audrey, and good morning, everyone. Thank you again for joining us for another virtual town hall where we're striving to do our best to bring you up-to-the-minute information on important resources and available tools for you to navigate through this pandemic. Finding the best childcare available to fit your needs during regular times can be very stressful, but during the pandemic, it's become even more difficult. And all of us are discussing now, how are we navigating childcare, school reopening, and still trying to manage our jobs and manage our families. Through our ALICE report, we know that childcare is often one of the most expensive assets of our monthly budget, and we're still trying to find ways to make it more affordable while also making sure that you're finding the most qualified child care associates to take care of your children while you're away. So today, I am very pleased to bring to you our very own Delonda McCullum and Jeff Miles from the United Way for Southeastern Michigan. Jeff Miles is our Senior Director for the Center for Early Childhood Excellence, and Delonda is our VCHAP Connect4Care Kids Specialist for the Social Innovation Fund. And so I wanted to share a little bit about them. Forgive me for bragging for just a moment, and then I'll turn it over to them to share with you this excellent resource that's available to families. Jeff Miles earned his master's degree in social work from Michigan State University with an emphasis on organizational and community practice. Jeff and his team work with local partners to develop strategies to replicate and scale programs that demonstrate measurable impact across our region. Thanks to Jeff's leadership as our Senior Director, he has received a 5-year award from the Michigan Department of Education to become the lead agency for the Southeastern Michigan Childhood Support Network, with the primary goal of supporting early childhood education providers and the families they serve across 10 counties in Southeast Michigan. Delonda McCullum has been in this business of serving children for quite some time. And before coming to United Way, Delonda was instrumental in the startup of the Wayne Children's Health Access Program. Delonda now supports the virtual Children's Health Access Program at United Way, and she helps to educate families on resources that are available to them, providing parents with information about the importance of connecting with a primary care physician, and helping families access transportation they need to connect with healthcare providers. She also helps families learn how to advocate for their children's health, and she provides training and consultations for partner agencies in her role as the VCHAP and Connect4Care specialist at United Way. And so without further ado, I'm happy to now turn it over to Jeff Miles and Delonda McCullum, who are going to now walk you through these opportunities and resources that are available to you and your children. So good morning to both of you and welcome.
Good morning. Thank you.
Good morning. And thank you all for joining us this morning. I just want to reiterate that what we're about to show you has been a true partnership with the City of Detroit and our federal partners at the Corporation for National and Community Service. This Connect4Care Kids builds on about 5 years of research and is designed to help you as parents find and connect to childcare. And we've really tried to incorporate your voice. And so we are also very interested in hearing your questions today and throughout the process so that we can continue to make this tool a better tool for all of us. And so with that, I'm going to turn it over to the true expert, Delonda, and she is going to walk us through this. And please, as mentioned, drop your questions in the chat and we'll happily answer those as we go along. So thank you all for joining us, and let's get started.
Good morning. Thanks, everyone. Great. Thanks for the introduction, Dr. Hudson. True, this wonderful initiative that we have with our Connect4Care Kids is making sure that we make Detroit a very attractive place to raise children. I truly understand when parents say, hey, I need to find a childcare facility. I was one of those parents driving from place to place looking for my child for Head Start, and then to come to find out that wasn't the proper Head Start, or going from childcare facility to childcare facility saying, hey, I would like to enroll my child. What do you offer? With this new platform, we have come up with a simplified way of making sure that these systems are user-friendly. One of the things that they were very instrumental in is making sure that children, that the parents had a word in this and really had played a part in this that they used with the city of Detroit and the I-Team. So they made sure that it was consistently heard throughout that, you know, we needed something that was easy to do, a wonderful platform, and that is user-friendly. So let's get started with the so the platform starts with our website. The website is Connect for Kids, connect4kids.org. So you are going to start at the beginning page, and this is how it looks. I have my information already loaded in. What is your zip code? How many people are you taking care of in your family? Of those people, how many children will be under the age of 3 by September, and how many will be 4? It will ask for your income eligibility, and this is just for a year, so you can always use your W-2 from last year, what you filed on your taxes. They'll ask, have you recently applied for Head Start and not been able to find a spot? It lets me know that I am eligible. I want Head Start as well as Great Start to Readiness program, because I have one child that's need Great Start to Readiness and one with Head Start. I filled in my information, and if you ever remember this fabulous number, 313 or 777-9311, that would take you back a bit, but you know, think about that one. And then it will ask you our infamous, wonderful, let's make sure that you are not a robot questions. You can receive a text, call, or email. I loaded in my address. And if you need any Spanish or Arabic translations, you can always give us a call, and I will be happily available to have those translations for you, or you can contact 211. I'm going to enter my children's information. Date of birth. It will ask, does your child have any special needs? You can say yes or no, they do not need. If they have not been diagnosed, don't worry. You can still get the testing done through the school. I'm gonna put for Josh that he does, and they just need to know the information for that. And they'll ask your household information, and I will be attending work and for school. And if I had any information, additional information, and then I'm gonna say, hey, I've seen everything on Facebook today. And would you like to be contacted by United Way 211 to follow up with you about your resources and services? You can put yes or no. And then you can also opt in to our wonderful Ready for K text messaging. This is proven to boost your child's development, literacy, and development. And you will receive 3 text messages a week with those different activities to do with your child. We are back at our verification questions. and then it lets me know what is the next steps. And then they'll tell you what's going to happen. This is just to check your eligibility. Someone from the child care provider, either Early Head Start, or Great Start to Readiness program will be contacting you, or if you have a child care subsidy, that child care facility may contact you as well. This is the information that you would need to have when you get ready to complete your application process with the facility. If you need a healthcare appraisal, that's connected here where you can get it printed off. And then if you like any bonus questions for your child to ask the child care facility that will be taking care of your child. I want to take you some more further into our website. This is a great tool right here where you can look up for child care facilities. It will have a filter on. And with this filter, I want to select Head Start, Early Head Start, and Great Start to Readiness Program, as well as the Michigan Department of Health and Human Services Child Care Subsidy, because I need that wraparound service for all three of my children. It's going to give you a location within a 5-mile radius for any parent. You will click on the bubble. It will let you know which each facility offers. So you can click until you find the facility that has all 3 locations for you, or 3 accesses for you. And usually when I click on this, which is so funny, I usually get all of them. And today, but even with this, it gives you the phone number, the address. It'll let you know if it has a star rating. It'll let you know by the X what services they do not provide. Here it goes. And also, if you see a 3-star rating or higher, that's less money that a parent would have to pay out of pocket for child care subsidy. So I can get all my children at one location, and I didn't even have to leave the comforts of my home. So I love this tool. The top bar is always going to be about United Way. This part is going to be strictly about Connect4Care. So I want to go to the resources, and we have a plethora of resources for you. We have the CDC milestones, child care checklist that I talked about earlier, the Detroit Schools Guide, the Great Start to Collaborative for Wayne, the Kids Health Connections, developmental screenings. That's our ASQ. You can take that test. It's only 2 of them that says take or connect to. You can take this test before you head into the Head Start. Know where your child is at developmentally, physically, emotionally, and socially. They will also do another test later on, and you could tell and reference that with your child to see if they are exceeding or went beyond the first test that you're taking. You can also take this information to your primary care doctor. They have early on for children under the age of 3 who has some delays that need some special services. We have our PPS Kids, our after school summer youth program, Discover Your Spark. We also have our summer meals for children, our Meet Up and Eat Up program, and the website that I just showed you with Find Your Child Care, and then our text messaging. One thing about the system is that it's so easy to use that, and if you ever need to do a connection, not that one, contact us. It will be this number right here at the top, or our email. And then how to use the tool. One thing, this is the same child care location near you, and then check if you're eligible. You have to do your check for eligibility before you can do your application process. So make sure that you check for your eligibility. You can come back as many times as you like to if your income changed, if you moved, you can come back as many times as you like to reapply for the eligibility part. And then this is for you to find childcare. And if you have any questions, this is where you can get answers at. Now let me go back here. What we did find out in data is that we are finding that it's 56% of Detroit's children age 5 and younger live below the poverty level, and that we have parents that have the general lack of awareness about programs and funding that is available for them. And other parents are hampered out by the out-of-date information by the time they get the information, web complications. This stuff all the information has been over multiple multitudes of websites, but you can fill out the whole application and then find out that you're not eligible. We wanted to make that easier. So we also have it where you can do the text messaging. You do have to opt in for this. And I will just show this and this will just show you how you can do your eligibility check. If you are doing this and you find out that your child, you find out that you are eligible and your child start doing different things, you put your phone down, you can come back, complete your eligibility application, not even worrying about if you have to start over. It will stop off where you started. So they're going to ask the same questions if you're eligible for the program. So they're going to ask the same questions that was shown on the web portal as well. You can come back on here just as well as to asking the same questions over and over with that.
Thank you so much, Delonda. This has been such awesome information. I want to make sure we get a chance to get to some questions as well. So it was a great overview of the site. A couple of questions that we have here are, can anyone use this website, and who specifically is this program meant for?
So the program is meant for the city of Detroit, families in the city of Detroit, for children 0 to 5. It is free. Providers can use it as well as families with children.
And are all Detroit providers included on the site?
If they have completed their information on the the Great Start to Quality portal, all their information will be on there. They can update their information in there. So if their information is not correct on our portal, they need to go into the Great Start to Readiness portal to update that information.
Okay, that was that was one of the other questions. Yes.
No, that's one of the beauties of the system is we're not asking providers to do anything else. This really draws on the data that they've already provided to the state through licensing and through the Great Start to Quality program. And so while it provides that access, we're not asking them to do anything else than what they're already doing. And I see
Great.
About translations, and the whole site will be translated into Spanish and Arabic. As Delonda mentioned, right now you can call the helpline and we can have one of our 2-on-1 translators on the line with you, helping you fill out the application in real time. And I do believe that is in other languages other than just Spanish and Arabic.
It is.
Great. And Delonda, when you showed the site, it looked like when you fill out the information, are you automatically enrolled in the Head Start program, or is it just that somebody's contacting you?
You're not automatically enrolled. You are checking for your eligibility, and the application will let the providers know that you are eligible for the program. They will call you back to make sure they will complete the enrollment. So that's why I said you will need those additional documentation, the birth certificate, your W-2, the immunization form, to be ready to submit to that provider.
Okay. And then is there any cost to utilizing this program?
There is nothing. It costs absolutely nothing. It's totally free to use the program, to go on the website or use the text messaging. Your text messaging base may apply, but.
Can you share that text number again? And I know we can put it in the chat too. But that's great. You can do it online and through text. I know that makes it really accessible to a whole host of people. We have another question here too. Are foster care parents eligible for subsidy and Head Start programs?
They are. Once they, I'm getting a number for you. Once they complete the application, once they go through the process, it is a question on there if you're a foster care parent. And that's if you have a higher income, that's when that denomination will come in there of saying what you're eligible for.
Okay. And you mentioned the ages and stages questionnaire and the screening. Can you expand a little bit further on why that's important and what that kind of looks like for parents?
So the ages and stages questionnaire lets you know where your child is developing physically, emotionally, and social-emotional. So with that, you take the test. It's very simple and easy. It's just like, can they pick up blocks? Can they bounce a ball? Can they repeat some things that you're doing? If there's a delay, this will help the teachers to better educate your child or help them in those delay parts that they're having. or where they're falling behind on, to help push them and boost them. Even with our Ready for K will help with that. They will also, once you complete the whole application, they will give you resources and different activities that you can do with your child to continue to boost their learning. It's so critical to have kids learning at such a young age. I can tell from my 3 children, 2 of them went to preschool and Head Start, and the one that didn't, I can tell the development with them when they got into school. So it's so important to have your kids in some kind of education very early.
Great.
And we've really tried to make that available to more parents, you know, understanding that the world has really changed, and a lot of the places that these screenings were occurring, we're just not sending our kids to. And so if you go to connect4carekids.org, you can get connected right to that screening tool, and then all of the resources that are available to parents after that. And it's really more important now than ever to make sure that your children are staying on track. And so we really wanted to make sure that these great resources are available. And as soon as you do that screening, you're immediately connected to our text messaging program. This is evidence-based. It was developed by Stanford University. It is really a best-in-class program that is going to help you help your child remediate some of those, or help keep them on track as they continue their development.
Yeah, I've used the text messaging myself with the Ready for K, and I love all the different aspects of that program as well. It's been great. And just a couple more questions here. And one of these is, Delonda, how do I get you to come train? Who do you train, and how do I set that up?
If you would like for me to come do a training with you, you can use the contact information that was provided on the website, and it's the Connect4Care number.
That's great. And what types of things do you review when you're doing your trainings?
I do the same information that I went over before, and if providers wanted to get connected, I have connected with MIHPs who are saying, hey, this is great information to know. And this is just letting the community know what's available for their families. So just to have that knowledge base, a lot of people are just very excited about this new initiative, and they're just saying how easy it is, and just to have that one-stop shop is very important in this day and time that we're living in.
Definitely, definitely.
And the connection to 211. There's a lot of information about childcare on there, but we understand that families are facing a whole suite of issues, and that is why we asked that last question. Would you like to be opted into some further conversations? Because we know utility assistance, homelessness, there's just a slew of issues that families are facing outside of childcare, but this is one door into all of those conversations. And so, yes, you may be asking for childcare today, but we know we can help you on a lot of other issues as well if you want. And if you just want to talk about childcare, then that is fine as well.
Yeah, and I would just say, is there anything else that you feel like is one of the most important takeaways that you could share with all the people who are tuning in right now?
I would just say, make sure that you check out the website. There's a lot of information on there. We have made sure that we had everyone involved, put enough resources on there for families that you will not be lost. That is one of the biggest things that I've seen on this website, is that it has everything that you need, from needing the application process of healthcare appraisal to any questions that you need to ask to find the appropriate child care provider for your family. And that's something that I didn't have with my kids. I had to figure that out on my own. So we made sure we cleared it for the family and to help with those questions.
My takeaway is text kids to 42273 and try this out on your own. And please give us feedback. We've got the helpline. And as soon as you sign up, we're also going to reach back out and ask you about your experience, because we want to continue to make this the best tool possible. So text kids to 42273. Thank you.
That's great. And I know we got some feedback here from a parent saying that they found the perfect place for their 2 young ones. And so we'd love to hear that type of feedback and really appreciate it. So just want to thank again, Jeff and Delonda, for joining us and for all the questions that you have provided us today. And now I'm going to turn it back over to Dr. Hudson.
Thank you, Audrey, and thank you so much to Jeff and Delonda. We love to hear that families are getting connected with resources. That's what we're here to do. And so to whoever just found the programs for your young ones, congratulations. And please keep us posted if there's anything else that we can do to help you and your family. And so you've heard us say 211 quite a bit. And I wanted to make sure that all of you were aware if you were in need, if you're having an emergency or a crisis, that 211 is still available. This is our hotline, our call and referral service that is available to you 24 hours a day, 7 days a week. You only have to start by dialing the 3 digits. If you would rather go online, I know we've been talking quite a bit today about online resources that are available. You can also go to unitedwaysem.org/211. And here you can enter any possible resource needs that you have, whether it's utility assistance, if you're looking for rental assistance, food pantries, even diapers. You can go to this resource, or you can call 211 and help is right there for you. It will connect you to over 1,300 different nonprofits and social service agencies that are in 6 counties in our region. And so please don't hesitate to call us if you are in need. We are also still continuing our virtual town halls. And so we hope that you will continue to join us. Next week, we are very pleased to bring Michelle Driscoll, who is our policy coordinator for the Michigan Alliance for Families. And we're going to be focusing on resources for parents and students with disabilities. And I also want to say this is also if your child has an IEP, an individualized education plan of any type. This is also the town hall that you want to tune into. And again, this is for any type of learning program that's going to be offered hybrid, face-to-face, or virtual learning. These are really key resources that we want to make sure that all of you have. And so feel free to sign up for any of our town hall alerts. You can get these alerts at unitedwaysem.org/virtual town halls. We have a number of past recordings that we've done, everything from unemployment assistance to mental health, also voter registration, census completion. And as you can see today, this is now our second town hall focusing on early childhood and child care resources for you. So just a few reminders. If you have not already registered to vote, please make sure that you do so. You will hear us continuously stress this between now and November 3rd and every day afterwards. Please take the time to register to vote. It's the most important tool that we have as Americans. We also are hoping that you take advantage of this time to continue to tell Congress about the supports that we need for COVID relief efforts. You can go to standwithunitedway.org and have your voice be heard. It's actually our advocacy tool. We'll show you tell you who to call, how to write letters, a number of different things to make sure that Congress knows exactly what your needs are in your neighborhood for your family, and that we're advocating for your needs. And lastly, and I see Amanda had also put this in the chat box, please, please, please get your census done. We are still pretty far behind for the city of Detroit as well as the region. And so you can go to my2020census.gov. It's only 9 questions. It takes it's not quite 9 minutes. It takes maybe about 12 to 15 minutes, but it's worth it. It brings $1,800 into our region annually per person. So we want to make sure that every person is counted. So with that, thank you so, so much. We look forward to seeing you next Wednesday. And take care, continue to stay healthy, stay safe, and be blessed.